Hello guys, welcome back to my YouTube channel. This is अभिजीत कुमार वर्मा from medicoz. I hope आप मेरी वीडियो एंजॉय कर रहे हो. अच्छी लगी तो लाइक शेयर सब्सक्राइब जरूर करना. आफ्टर लॉन्ग टाइम मैं दोबारा से आया हूँ. मैं अभी बांग्लादेश आया हूँ तो मेरे को थोड़ा टाइम लग गया मैनेज करने में, बट आई होप मैं वीडियो डालता रहूँ टाइम टू टाइम. आज मैं आपको फिजिकली बताऊंगा क्या कहते हैं वर्टिब्रा के बारे में, प्लस रिब्स के बारे में नेक्स्ट वीडियो में बताऊंगा, और साथ ही मैं इन दोनों को आर्टिकुलेशन के साथ बताऊंगा कैसे आर्टिकुलेट होती हैं. तो आज हमारा मेन टॉपिक है थोरेसिक वर्टिब्रा. एज वी नो थोरेसिक वर्टिब्रा हमारे होते हैं 12. ओवरऑल वर्टिब्रल कॉलम हमारे इन द केस ऑफ एडल्ट होते हैं 26 एंड इन द केस ऑफ चिल्ड्रन देयर आर 31 बिकॉज सर्वाइकल 7, thoracic 12, lumbar sacrum 5 and the coccygeal 1. Overall in the adult case it is 26 and the children it is 31. This was the basic knowledge as you should know because we studied in the class 11 in the case of skull. Now today I will tell you about the thoracic vertebra. Thoracic vertebra, first of all, before telling you should classify into three types according to morphological, according to position and according to ossification. Now according to morphological, this first of all it is a body. Overall it is an irregular bone, but its body is a modified long bone and its the other processes are the irregular bone. And according to the position it is axial, and according to ossification it is intercartilaginous. I hope you studied in the case of BTC handbook. Otherwise, I will tell in upcoming videos also what is cartilaginous, what is mesenchymal, and all that membranous. I will tell you in the upcoming videos. Now, in the case of vertebra, there are two types of vertebra: typical and atypical. That for the atypical vertebra are 1, 9, 10, 11, and 12. But for the typical vertebra, it comes from 2 to 8. Now, before telling, I will tell you about the typical vertebra. First of all, the examiner will ask you about the anatomical positions and its parts. So, a typical vertebra consists of a heart-shaped body and a vertebral arch. I will tell you about this is the body, this is the heart-shaped body, this is the heart-shaped body, and this is the vertebral arch. As you can see, this is the arch is formed here. It is a vertebral arch. Okay. Now, in the anatomical position, first of all, its parts: body, vertebral arch. These are the transfer processes. See, these are the transfer processes. This is the spinous process. This is the spinous process, and these are the lamina, which are connected by the ligament of flava and example of fibrous joint. You might have studied in the BDC handbook. It is there. Now these are the supravertebral notches. These are the inferior one notches, and now we talk about the. In the case of typical, since it is a typical vertebra, it will be having a demifacet, upper and lower. See carefully, it is a demifacet. See demifacet, superior one, and the inferior one demifacet. See, you can see it clearly. Okay, so these were about demifacet. I am repeating it again in a short. In anatomical position, you have to hold it from the transfer process. See transfer process. So if you are the examiner, I will hold it like this. Transfer process. Okay, this is the body. This is the vertebral arch. These two are the transfer processes. This is the spinous one. These are the lamina. Pedicel. This was the pedicel. Then this was the upper costal demifacet and the inferior costal demifacet. Okay, and superior vertebral notch, and this was the inferior vertebral notch. Okay. Now I am telling the anatomical question how you tell the examiner. Then I will tell about the vertebral foramen, intervertebral foramen, and nothing else is there in this case. You will able to learn easily. It is nothing more complex. Okay. So now I am holding in the anatomical question from the transfer process. I will tell you about, since it is a typical thoracic vertebra. This was the vertebra. It consists of vertebral body, which is a heart shaped. You can see carefully, it is a heart shaped. Anatomic portion I am holding it from the transfer process. Okay, it consists of vertebral body, which is in the front one, and the vertebral arch. Here comes the anterior longitudinal ligament. Here comes the posterior longitudinal ligament. Okay, now these are the transfer processes. These have the facet for the articulation with the tubercle of the rib. I will tell you in the upcoming video. Okay, this is the spinous process. You have to tell the examiner, and the lamina. These are the lamina. Superior vertebral notch, I am repeating it again twice so that you can easily understand. Superior vertebral notches and the inferior vertebral notches. Okay, and now these are the upper costal demifacet and the inferior demifacet. I'm telling this about a typical vertebra, typical thoracic vertebra. Okay, and now the question sometimes asked like this is also a typical thoracic vertebra. Sometimes what question occurs na, actually it is not typical. I'm not having the exact case. Okay, so I will tell you in the short form. Okay, so you can adjust it like that. Okay, so now you can see it. First of all, before this is the vertebral foramen. Okay, vertebral foramen. From here it passes this is the vertebral foramen. From here passes the spinal cord covered by the meninges. Spinal cord, you know from where it comes, dorsal root ganglia and the ventral ganglia together combine forming the spinal nerves also. Okay, and after coming from the intervertebral foramen, they divide forming the anterior and anterior posterior rama. This you should know because it is the part of the intercostal vessels. Okay, so now in the case of it, between these vertebrae, see, okay, you can see the space. Okay, you can see the space. Okay, these are the intervertebral foramen which is between the vertebra, and from here it passes the spinal nerves. There are more things, but for our level the spinal nerves are okay. And now we can tell about the joints. First of all, between these two vertebra, presence of intervertebral disc. Intervertebral disc, the constituents. In between there is the presence of nucleus pulposus, and the periphery there is the presence of annulus fibrosus, example of fibrous joint. Okay, now nucleus pulposus shows a remnant of notochord. It is an important part. Now sometimes examiner asks what is the development of thoracic vertebra or the vertebral column. You can shortly say it is from the sclerotomous part of the mesoderma sumai. It is the short form. Okay, after this you can tell about the intervertebral disc, then you can tell about the costotransverse joint. Okay, so आई होप यू एंजॉयड दिस वीडियो. आप आखिर तक बने रहना बहुत जरूरी है इस वीडियो में आपको. ठीक है, मैं बीच में आपके साथ कुछ शॉर्टकट्स भी लाऊंगा बताने के लिए, उस पर आप ध्यान देते रहें. सो ओवरऑल दिस वीडियो इज कंप्लीट. तब तक के लिए अब हम मिलेंगे नेक्स्ट वीडियो में. थैंक यू. स्टे हेल्दी एंड स्टे सेफ.